Toric tactics. Toric marking made easy. Worldwide, while adopting this toric IOL in cataract surgical practice requires pre-planning of two markings. Appropriate surgical instrumentations are required to perform these markings. Freehand marking induces misalignment error in the exact identification of 0 to 180 degrees axis, which may lead to a shift of the toric IOL placement axis concurrently. The first marking is done at 0 to 180 degrees axis. Marking with a needle in the slit lamp creates discomfort to the patients. Edge thickness of these marking instruments might induce additional errors. The placement axis marking of the toric IOL, which is done intraoperatively on the anterior cornea. On-table marking with the ink might smudge due to the constant fluid flow. A simple procedure for implanting the toric IOL by not using the conventional marker pen or marking instrumentation. This virtual toric align software visually guides the surgeon through a monitor display for the exact placement of the toric IOL on its calculated axis. This toric tactics depicts a new and simple methodology for achieving an accurate target placement axis, a surgical video overlay system with inbuilt designed virtual toric align software which guides the operating surgeon. Firstly, the patient ID number and the selected eye for surgery is entered in the software. This will retrieve the complete patient database entered, which is previously entered and stored. Now, the set angle key is pressed. Show video option is selected to view the microscope video of the eye in the image capture window. Few calibration steps have to be carried out as indicated in the caution message prompt before the patient is made ready for the surgery. Based on the surgeon's sitting position on either the superior, temporal or supratemporal position. To achieve a perfect orientation of the operating eye, a set of bilateral eye template tools for different magnification settings of the microscope is provided. As a first calibration step, the optical head of the microscope is fixed as decided by the surgeon to suit his own comfort zone. This is to obtain the exact reference angles of the operating eye to match the scale marking in the software as a reference axis from canthus to canthus point in the capture window of the software corresponding to the circular scale angle as indicated. The working magnification of the surgeon during the surgery is also set. Toric overlay is activated to indicate all the details pre-calculated and it is overlaid in real time over the video image of the eye. The incision angle in which the surgeon has planned needs to be entered, which is indicated by a red arrow mark. On a circular scale, a white line across the central crosswire indicates the 0 to 180 degrees reference axis. A green-colored line of axis in the software screen indicates the surgeon to position the toric IOL in its placement angle, which is a pre-calculated data. Noted landmark angle from the slit lamp scale is entered into the software to compensate cyclotorsion in the supine or lying position on the surgical table, which is indicated by landmark axis orange colored line. This landmark axis line is rotated to coincide with the chosen landmark blood vessel by moving the slider option, or can enter the numerical value of the cyclotorsion analyzing angle using the keypad provided. Regular phacoemulsification surgery is performed after making the incision at a location as indicated by the red arrow mark in the overlay with due consideration of the cyclotorsion compensation in the lying position. Finally, while dialing the toric IOL to its designated placement axis, the surgeon looks at a comfortable gaze angle at the monitor, which indicates the exact placement angle in the software overlay as the green line axis, which indicates the surgeon to instantly dial and align the toric IOL to its designated axis. As suggested by toric calculator software, the central fixation is achieved by simultaneously checking the central crosswire or the red dot placed over the naturally formed Purkinje image reflection from the cornea without any surgical instruments touching the eye. The final placement of the toric IOL and its position is captured by pressing the screenshot key as multiple sequence of images. The results obtained through immediate 3 hours post-operative aberrometry performed and toric planar analysis indicated accurate placement on the exact designated placement axis with 100% accuracy. Conclusion. The toric IOL practice becomes a child's play with this unique toric tactics methodology.
Toric tactics very